Okay, this is the last screencast for this section. Believe it or not, so I was just kind of wrapping up the breast and the lymph nodes, tips for surgical coding surgical procedures. I did want to show and take some time. I did put an example of an op report in here. Just so you could kind of see the layout, how we kind of read the description of the procedure in detail to kind of see, you know, what's going on here. So for this one, we see the pre-op diagnosis, squamous cell carcinoma of the scalp. The post-op, they just say same. Okay, so we know this, our diagnosis is going to be squamous cell carcinoma of the scalp. The operation performed, they did a radical resection of the tumor, of a tumor of the scalp. They did an advanced flap closure with total undermined area 18 centimeters by 16 centimeters. Here I have my surgeon listed. I actually have my anesthesia listed, my anesthesiologist listed. Sometimes you will have a wonderful op report and all this will be listed. Sometimes it will not. Of course your surgeon will, but sometimes they don't always give the anesthesiologist, but you should always have the type of anesthesia. The indications, why are they doing the procedure? The consent, to just give them the risks. The findings, what did they find during their procedure? And then here is our description of the procedure in detail. So this is where the coder is really going to pay attention to, and they're going to need to read. As you get more familiar with the different types of procedures, you're going to know exactly how that detailed op note is going to look and be dictated to where you could code straight from here and know exactly what's going on without them giving you a little hint up here. It takes a lot of practice though. So here the patient was taken to the operating room and they were placed supine on the operating table. There's the position. General anesthesia was administered. They were performed by the anesthesia service personnel. The patient was therefore prepped and draped in the usual sterile fashion or manner. So they're getting him ready. Therefore, the local anesthetic was injected into the area around the tumor. An excision was planned down to the subcutaneous. A radical resection was performed of the scalp. And we can see here the patient had a 4 centimeter large lesion. So here you could be like, well, how big was that resection that they performed? And they do have that up here. Okay, it was obvious there was a tumor at the deep margin involving the subq of the scalp. The edges were marked along the 4 quadrants at the 12, the 3, the 6, and the 9 o'clock positions. These were sent for frozen section. Evaluation, frozen section revealed positive margins at one end of the resection. Therefore, an additional circumferential resection was performed and the final margins were all negative. So here we have our radical resection of the tumor of the scalp. Now, following completion of the resection, the area was irrigated with copious amounts of saline. Therefore, advanced flaps were created both on the left and the right side of the scalp, and the total undermined area being approximated is 5 centimeters by 2 centimeters. You know what? That is not the same as up here. So we're going to make this, I had to copy this and I changed some things. So this actually should have been changed, and you're going to see me do this, of course. Nothing like doing it live. 5 centimeters by 2 centimeters. And then in our coding, as you guys learn more about the coding, when you have a radical resection of a tumor of the subq and an advancement flap, only the advancement flap is going to be coded because the radical resection is actually included with the advancement flap, but that's just a coding guideline. But that is how we're really looking to see what was done, where did the procedure start. We could have coded both codes, and then when we went to go code it in our code book, we would have saw that the radical resection is included in the adjacent tissue transfer. So we're going to go through a lot more of these as we dive more into all these different CPT surgical sections.